Earlier this week, we told you about how the more transmissible Omicron BA.5 subvariant has now become the dominant strain of COVID here in the United States. It's leading to a rise in cases in more than 40 states. Well, there's now another variant I'd like to introduce you to. It's the BA.2.75 variant. It was first detected in India, but has already been found in 14 other countries, including here in the U.S., where cases have been reported in 7 states. And because this variant has even more mutations than some of the predecessors, there's concern that it could fuel a rise in cases over the next couple of months here in the U.S. Joining me now, Dr. Anne Rimoin. She's an epidemiologist at the UCLA Fielding School of Public Health. The pandemic is not over, Dr. Rimoin, and I want everybody to first wrap their head around BA.5. But as they are kind of struggling to do that, I think, in this moment here, help us understand BA.2.75. What do we need to know about that variant?
Well, Zerlina, you're right. The pandemic's not over. We're still going to continue to see new variants emerge. And of course, this virus has a lot of runway and a lot of vulnerable people to go through because this virus, BA.5 and BA.2.75, all have these properties of immune evasion, meaning that if you have had COVID before, or if you are vaccinated, you might not be able to fend off an infection. So, I think that the key here is we're going to continue to see new variants, and it's all yet to be determined what these variants will mean. We're seeing BA.5 as the current variant that's circulating most prominently here in the United States, BA.2.75 circulating in India, outcompeting BA.5. It's all yet to be determined what it means.
It's pretty scary, though, because variants, as you said, they're going to continue. But what role do we play in the perpetuation of all of these variants? Can we do something to stop the continuation of this trend that we're seeing where there's just a new variant every couple of months?
Absolutely. We know that there are things that we can do, like getting vaccinated, which will certainly reduce the potential for getting infected, though it will not. It's no guarantee. Of course, avoiding contact with people that are outside of your household, where you don't know if they're infected or not, or what their exposures have been. It's always a good idea to take those activities outdoors if you can. Wear a mask in indoor crowded settings. I mean, we've talked about this before. This is something that actually does make a difference. I think that just being aware of your surroundings, making decisions about what it is that you're willing to go do, knowing that you're seeing virus transmit, and taking the precautions that you can. Masking, vaccination, outdoor activities now where possible, those things will all reduce the spread. This is nothing new. This isn't a new discussion that we're having. It's the same things that have worked before are going to work again.
Important to keep in mind. I want to turn to the topic of monkeypox, another virus that is spreading all around the world. In early June, there was about a dozen cases in the U.S., but now there's more than 2,000. And you actually are somebody who is an expert specifically in monkeypox. What do the people at home need to know about monkeypox?
Well, monkeypox is spreading, as you are seeing, in a new way that we never saw it spread before. I've been working on this virus for 2 decades. And during this time, monkeypox has really been predominantly in low resource settings, like in the Democratic Republic of Congo, in villages where people are hunting for sustenance. Now we're starting to see it spread in a totally different way. We actually don't really know what the number of cases, the true number of cases that are out there really are, because there's not enough testing available right now. Access to testing is really difficult. Also, clinicians aren't always thinking about monkeypox when they see a rash. So there's probably a significant amount of underdiagnosis as well. I think the key here is that we do very rapidly need to be able to get testing out, so we have great situational awareness. Physicians really do need to expand their minds in terms of if you see a rash and there are exposures that that might be relevant, you should really sample that and send it forward. And we also have to remember that this is a virus that has been spreading for a long time in places like DRC, where I work, and in other places in sub-Saharan Africa. And if we're really going to get in front of it, we're going to have to be able to deal with it at the source, which is, of course, something that we've never been good at doing.
Sigh. Dr. Anne Rimoin, thank you so much for being here and helping us understand all of this. I would say the takeaway is put your mask back on. That conversation. Please stay safe. Have a great weekend.
Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.